Thank you, Mr Speaker. I rise to speak on the budget debate, and the sixth budget from our Finance Minister, the Honourable Bill English, delivers where it matters most for our children and for their families. Thank you. Shall I start that again? What do you think? Start the clock? Start the clock. Okay, so this is a budget that delivers where it matters for families and for vulnerable New Zealanders. There are a lot of measures I could talk about in my contribution to this budget debate. I'll concentrate on just three of our priority areas: health, education, and how we've helped vulnerable children. Now, no minister or member of Prime Minister John Key's caucus is ever allowed to indulge in the kind of rubbish and rhetoric that we've heard from the opposition so far. This big spending, big borrowing, squandering of taxpayers' hard-earned money, no way. We have a plan, we have targets, we work towards them, and we have a very disciplined approach. And until we reach the targets, until we reach the savings, then and only then do we allocate money to invest in our priorities. Now, Tony Ryle is a very good example of his kind. A canny manager of the public health purse strings, our Health Minister's very careful control over the health budget in the past 5 years has seen DHBs reducing their deficits from an estimated $200 million overboard to around $25 million. And by clawing that back, it's helped free up some $412 million of savings that are now available to invest in new health initiatives. That's a stark contrast to the incompetent management of Labour's Annette King when she bumbled her way through far too many years of mismanagement of our health system, borrowing and spending up large in all the wrong places. Waiting lists grew. We had people going overseas for cancer treatment. We had endless examples of people who were very ill in stretchers and corridors, and I'm only talking there about my own electorate in the North Shore Hospital. The DHB at Waitemata has been turned around. And under Tony Ryle's governance and Lester Levy and the rest of the team, it is now a world-class, top-performing DHB, and one I'm very proud to have in my community. Again, a stark contrast to the hopeless bumbling that we saw with Health Minister in the Labour administration, Annette King. Now, under Tony Ryle's watch, 40,000 more patients every year now receive more hip and knee replacements, and we will be spending another $110 million on those sorts of elective surgeries. Now, these are the sort of operations that really are priceless to the patients who receive that new knee or that new hip. It reduces their pain, it restores their independence, and it really does improve their quality of life. Under Tony Ryle, for the first time ever, our health spending will top a record $15.6 billion. That's allowed the Health Minister to target the spending to where it will make the most difference. He's invested $33 million into better cancer services. And for the 20,000 New Zealanders each year who receive the terrible news that they have cancer, they will have better and faster diagnostic and treatment services. Again, that is priceless. In my North Shore electorate, people have come up to me since the budget in the last few days, and they've said how delighted they are with the extension of free GP visits and free prescriptions that's being included and rolled out now to children under 13. That $90 million investment has been very welcomed by agencies like Plunkett and all of the parents I've spoken to who've said they won't hesitate anymore to take their children to the doctor as soon as the children start to show signs of illness, which means that the children won't get as ill. It gives peace of mind to the parents and saves a lot of misery for the children, and it's expected that some 400,000 primary school-aged children will benefit from that measure alone. An extra $112 million for disability support services to meet the rising needs and costs will make a huge difference to the 1 in 5 New Zealanders who suffer from disabilities. Our seniors will also really appreciate the $96 million for home-based support services and the $40 million for additional support for elderly people, including those with dementia, and there are more details to be announced on that a little later. There's also going to be spent in this budget a further $20 million for the rheumatic fever prevention program and $4 million to increase the number of renal transplants performed. Now, I know about this firsthand in my own electorate. A couple of weeks ago, Tony Ryle, I represented him and opened a new community dialysis centre in Mairangi Bay, a state-of-the-art, world-class facility that's going to make a phenomenal difference to the quality of lives of the people who suffer and have to do renal dialysis all the time. It is a marvellous facility, and the stories were absolutely heart-wrenching, and the joy that those people felt at being able to have such a facility within their own community so they no longer have to travel long distances to get the treatment that they require. When it comes to education, education, Ministers Hekia Parata and Associate Education Minister Nikki Kay have really delivered for our children in places that matters. Our spending on early childhood education is excellent, and combining it with primary and secondary education, it's going to be about $10.1 billion in this financial year. We're investing $155.7 million of that into early childhood education services, and that's really going to help the parents who have to take the choices to go back to work, the parents who require and need to know that their children are being looked after well. We all know, I think, that early childhood education plays a crucial role in giving children the right start in life, particularly our most vulnerable communities. And I know that Hekia Parata is particularly proud of the gains that we've made for Pacifica and Māori children in that regard. It's gone from a very poor turnout and a very poor uptake of early child care services and early childhood education into a much more robust participation. We targeted, as many of you know, we've talked about it in the House often enough, that 98% participation of New Zealand children will be in early childhood education, and that will be by 2016. We're already delivering at 93% of that, and very likely to reach the target beforehand. So when you look at where the money's been spent, Labor managed about $800 million on early childhood education back in 2008, and we have put out $1.5 billion. That's how much we care, and that's how much we believe that we put our money where it counts with our young and our vulnerable children. And that brings me to the Honourable Paula Bennett. This budget has also invested to protect our most vulnerable children. The tragic statistics are indeed sobering. On average, there are around 22,000 cases of abuse and neglect of New Zealand children each year, and more than 50 children have died in the past 5 years because of extreme abuse. That is intolerable, that is unconscionable, and it must not continue. It is horrific, as the Junior Whip has just said, and I think it's sobering for all of us to be reminded of the statistics, to know the names of the Nia Glassies, to know the names of these children who represent the tragic face of these terrible figures. We really need to put some money into that and to make a real and practical difference by committing to the most vulnerable children. And we are doing that. The protection for children from abuse and neglect has been further strengthened in this budget by $33 million in operating funding. The budget has committed $16.5 million to continue developing new ways of working together, implementing the new services and ensuring greater monitoring of at-risk children and young people. One of the things I really like about the way that the Honourable Paula Bennett operates in this space is that she knows it so well, and she has an enormous enthusiasm for it. She came to my electorate and we went into the WINS office and the SIFS office. These were unannounced visits, and she certainly made an impact when we went in there. She has a way of bringing people together, and I think that one of the very successful things is encouraging the various agencies to work together in a way that is cooperative. They don't share private details unless they need to, but by talking together and working together in a common cause, it's been a fantastic, it has really worked. And I think that the good progress that she's making in implementing the Children's Action Plan, with 2 children's teams up and running already, one in Rotorua and one in Whangarei, and the new funding is going to be able to mean that 8 extra children's teams will be rolled out in the next financial year. These are the measures, Mr. Speaker, that are making a phenomenal difference to families and to children and to vulnerable people in New Zealand society. We are not sidetracked by the sideshow, the sort of the muckraking and the ludicrous antics of a desperate opposition. Their braying and their unhappiness is evident. You look across, they're unhappy people. They don't like their leader, they don't like their policies, they don't like their chances of getting the Treasury benches anytime soon. And for the good of the country, I'm very grateful about that. I think that when I look at this budget, I see a family-friendly budget that makes a huge difference to people's lives where it matters. We'll put aside the trivia and the nonsense and the I suppose, desperate posturing of our political opponents, and instead focus on the extraordinarily good benefits that have been handed down in this budget. I'm very proud of this budget, and I commend it. Thank you, Mr. Speaker.
Ian Lees Galloway.
Thank you very much, Mr. Speaker. You know, the best way I find